Hello everyone, welcome to HIM 225. This is the second in a series of lectures covering chapter 15 in your textbook. If you would please turn to page 334, and we're looking at the first example on this page. The patient was admitted with acute chest pain due to pneumonia. In this example, we are only applying the code for pneumonia. We're using the default code J18.9. And that is because the pain is integral to the pneumonia, and so we are not coding that. In the next example, the patient was admitted for acute pain control after falling off a ladder and suffering 2 broken ribs on the right side. The patient was admitted for pain control. So in the index, we would go to pain and then acute due to trauma, and that code is G89.11, and of course we will verify that in the tabular. Now she also has 2 broken ribs on the right side. So broken ribs are fractured ribs, and this is a traumatic fracture. So in the index we would go to fracture, traumatic, and then rib, and she has multiple ribs fractured. So we would choose this code S22.4, and then of course we're going to have to complete the coding by looking in the tabular. And so this was multiple fracture of ribs on the right side. So we know that we have to have additional characters for this code, and this was the initial encounter. It was a closed fracture, so our 7th character is A, and we have to use the placeholder of X. And actually, if we go to the beginning of this category, we can see these 7th characters that have to be assigned for each code from category S22. And those characters are based on whether or not it's an open or a closed fracture, whether it's initial, subsequent, whether or not there are healing issues, routine healing, subsequent encounter, subsequent for delayed healing or non-union, or a sequela. So if this was a sequela, if we had documentation of a sequela, then that 7th character of S is what we would use. In addition to that, this patient fell. And so we are going to go to the external cause tab. Now in this external cause tab, we are putting in fall, and she fell down a ladder. If we just try to put ladder, nothing comes up. So we have to choose fall down ladder, W11. Now when we get to W11, we have to have a 7th character. This was an initial encounter. We're going to be consistent with that 7th character. And so we have to use placeholder character X to fill in until we assign that 7. So W11.XXXA for that 7th character. And so that is our code for that fall. The next guideline that we're looking at is category G89 codes as a principal or first listed diagnosis. And the guidelines tell us that these codes can be used as a principal or first listed diagnosis when the pain control or pain management is the reason for the admission or encounter. And the example they have here is that a patient has a displaced intervertebral disc with nerve impingement and severe back pain. They're coming in for injection of steroid into the spinal canal. So the underlying cause of the pain would be reported as an additional diagnosis if known. So let's look at this example. The patient's admitted to the hospital with acute testicular pain. The patient had a vasectomy yesterday, and the physician documents post-procedural pain. So the first thing we need to do is click on the Diagnosis tab to get out of the External Cause tab. And I'll tell you, I forget to do that all the time. I'll be in External Cause, and then I'll try to code, and I'll realize things don't look right, and then I'll realize I haven't clicked out of the Diagnosis tab. So make sure you click back on the Diagnosis tab. Then we're going to pain post-procedural NOS. You'll notice that postoperative pain is the same code, G89.18. And then, of course, we're going to code the fact that this patient has testicular pain. So in the index, we're at pain and then testes, N50.81. So we have to go to the tabular to complete this coding. And we don't have any documentation of whether or not it was left or right, so we're choosing the unspecified code, N50.819. So the next guideline talks to us about the insertion of a neurostimulator for pain control, and this is quite commonly done. So it tells us that when a patient comes in for insertion of a neurostimulator for pain control, then we assign the appropriate pain code as the principal diagnosis. When the admission or the encounter is for a procedure aimed at treating the underlying condition, and a neurostimulator is inserted for pain control during that same admission or encounter, then a code for that underlying condition should be assigned as the principal diagnosis, and then the appropriate pain code would be assigned as a secondary diagnosis. So there are times when patients come in to have a procedure to treat a condition, and at the same time they will put in a neurostimulator for pain control. And if that's the case, then you have to code those appropriately based on the condition that occasioned the admission. But if the neurostimulator is being placed just to control the pain, and that's the reason for the admission, pain is the principal diagnosis. So let's look at this example. It's the fourth example on page 334. Patient has chronic intractable pain secondary to lumbar spinal stenosis. She's admitted for insertion of a neurostimulator, single array, for pain control. The generator is inserted into the back pocket, and the leads are inserted into the spinal canal via a percutaneous approach. So we are at pain, and then we are at chronic. None of these subterms are appropriate, so we are choosing the default code G89.29, which we will verify in the tabular. Then we know that this patient has lumbar spinal stenosis. Now, in the index, we are going to go to stenosis, spinal, and then lumbar. And we'll see that the code is M48.061. So this is a code that has been updated since your book was printed. So the correct code for this is M48.061. Then the next thing we're going to do is code these procedure codes. So we go over to the procedure tab, and in the index, I have typed in neurostimulator. And we have a number of options here, but what we are looking for is this single array for pain control. And we can see if we come down, neurostimulator generator, single channel, single array. It sends us to table 0JH. Now when we go to 0JH, then we have to choose the appropriate location, the appropriate body part. And it tells us that this was placed in the back. So it's subcutaneous tissue and fascia back. This is an open approach, and we are putting in a simulator generator single array, so our character is B, and there's no qualifier. Now the other thing that we have to code are the neurostimulator leads. And you'll notice in the index we have neurostimulator lead, insertion of device in, and this tells us that it was the spinal canal, it was percutaneous, so we are going to choose this table 00HU, and our approach is percutaneous. It is a neurostimulator lead, and there is no qualifier. Our next guideline talks to us about assigning a code from category G89 and a site-specific pain code. And basically, we can assign both codes. We may have a site-specific pain code that doesn't specifically identify the pain as acute or chronic, so in that case, it would be appropriate to assign an additional code from category G89. So let's look at this last example on page 334. The patient is admitted with acute back pain after being rear-ended by a car while driving her children to school in her car. So in the index, if we go to pain and then back, we'll see the default code of M54.9, which of course we verify in the tabular, and my internet is slow. So there we go, back pain NOS. Now the next code that we want to assign is the acute back pain. And so we will be at pain, acute, and this was due to trauma, so we're at G89.11. And then she was rear-ended. She was the driver of a car, and she was rear-ended. So we're over at the external cause codes again. Now for our V code, she was driving and she was rear-ended. So she was hit by another car. So in the index, if we go to accident, let me show you. This is not the easiest code to find. If I go to accident and then car, it tells me to see accident, transport, car occupant. Now, she was the driver, so we have to put a comma and then put in driver. It was a collision with another car. So our code is V43.52, and then we have to have the 7th character to show that it was an initial encounter, and so we'll have X as our placeholder and then A as our for our initial encounter. Your question for this lecture is to go to exercise 15.2, which is on page 349, and answer question number 11. There are 3 codes for question number 11. The patient's coming in for pain control. She has acute abdominal pain that is related to her pancreatic cancer. Now on the bottom of page 334, sequencing of category G89 codes with site-specific pain codes. Basically, this tells you that the sequencing of the codes is dependent on the circumstances of the encounter. So if the encounter is for pain control or pain management, then we're going to assign a code from category G89, followed by a code identifying the specific site of that pain. If the encounter is for any other reason except pain control or pain management, and there's a related definitive diagnosis, and a related definitive diagnosis has not been established, then we would assign the code for the specific site of the pain first, and then the code from category G89. So let's look at this last example on the top of page 335. The patient presents to the ER with acute chest pain secondary to being kicked in the chest by a horse. So in this instance, we are going to be assigning this code for chest pain as the principal diagnosis code. And the default code for a pain chest is R07.9. Then we have our acute pain due to jump trauma, G89.11. Then we have to go back to external cause codes to code this being kicked by the horse. So we're going to go to the external cause tab, and let's see, kicked. Animal, NEC, but we have a horse. Now this person was kicked by a horse. So you would think that you could go to kicked by and horse and find it. This is a very difficult code to find. In the index, you have to go to contact with horse strike, W55.12. The way that I found this code is I actually went to the tabular to look in the at the sections, and I chose the category that included, let me go and show you this again. So I chose the category that included accidents. And then this was not a transport accident, other external cause of injury. And then once I found that, then this was exposure to animate mechanical forces. How that gets into horse, it doesn't fit. Doesn't fit into any of the others. And then we come down. If we look at all of our different options here, contact with other mammals, and then we find the contact with horse, struck by horse. So when we look at this code, it was an initial encounter, so it's W55.12XA. So that will conclude this second lecture for Chapter 15.